Hey everyone, my name is Connor O'Day, currently social work major of the undergraduate BSW program at App State. Um, Here's my elevator speech for the policy brief proposal. Mine is restoring master's level pay for social workers throughout North Carolina. All right, hello everyone. Today I want to talk to you about an urgent problem currently facing our state. Right now, social workers at the master's level are not seeing any pay increases or very little increases from the bachelor's to master's level. Social workers in a clinical setting with a master's degree provide critical services, which include mental health, counseling, crisis intervention, addiction, and family service help. Social workers are significantly paid less than comparable professionals, such as counselors or psychologists. The pay rates are less. The turnover rates are higher as a direct result of companies not being able to retain these professionals, not paying them what they're worth. Currently, there's been some advocacy to increase the pay for social workers, but there's no statewide policy that ensures equitable pay for master's level social workers. Some policies in other states that have worked, that I've done some research on, such as in Oregon, where if you are like a master's level social worker, there's a significant pay increase from the bachelor's level program. Current supporters of these programs are the National Association of Social Workers in North Carolina, a lot of community health organizations, as well as master's level social workers. Like I mentioned it kind of in the introduction, it's really hard to retain social workers when they're not paid adequately. The results of this, when social workers leave because they're not paid adequately, people are facing longer waits, longer times to get in to see people for help. They're not receiving adequate help. Maybe they're just receiving help from mental health behavior technician, something of that sort, who isn't necessarily equipped with the skills and tools to handle situations and crises like a master's level social worker could. My proposal would be to restore and guarantee master's levels pay across all social workers in North Carolina, whether that is in a school, hospital, or community agency. It should dedicate state funding and guidelines to ensure the pay is equal. Evidence shows that pay equity improves workforce stability, reduces burnout, and enhances service quality. Investing in social workers is also an investment in our communities. We typically see, a lot of untreated mental health and social crises in areas where there are less social workers. And the same is true on the flip side, where there are more social workers and they're paid equitably in states that they are. Mental health issues are lower because they're being treated, and crises are lower because they're being adequately handled. So thank you for hearing me out. Thank you for considering this critical issue.